A recent government report revealed the appalling living conditions of the average enlisted soldier in the U.S. military. News.com has learned that the report, titled "Poor Living Conditions Undermine Quality of Life and Readiness," was conducted by the Government Accountability Office, GAO, and detailed dire circumstances faced by troops residing in stateside military bases across the country. The GAO, a nonpartisan group of investigators who report to Congress, conducted an extensive investigation, visiting 10 different military installations in various climates throughout the continental United States. The report, per Vice, contains disturbing images of broken windows, malfunctioning air conditioning systems, black mold, and raw sewage. Interviews with military personnel, both enlisted soldiers and officers, shed light on what life was like at these facilities. One tragic incident highlighted in the report concerned the aftermath of a troop's suicide. Military members were assigned the task of cleaning up the room where the individual had taken their own life, a course of action considered untoward as it spoke to a lack of support and resources during distressing circumstances. The GAO report also included photographic evidence from bases in California, Colorado, Texas, and Washington, D.C., and reviewed Pentagon records regarding the state of the facilities. These images documented cases of sewage overflowing in bathrooms, requiring constant efforts by troops to prevent further damage. Mold infestations were also prevalent, with service members reporting respiratory issues directly linked to the presence of fungus. One soldier, after several visits to the emergency room, was transferred to a mold-free barracks. After he relocated, it was noted that the serviceman experienced remarkable improvement in his health. Another installation was characterized by its persistent foul odor, which was attributed to methane gas leaks from aging plumbing and cracked sewage pipes, while in a different barracks, an outbreak of Legionnaire's disease, a form of pneumonia, was recorded. Fire safety at these military installations proved to be another concern, with some buildings lacking functioning fire suppression systems. Photographs showed empty rusted fire extinguisher boxes. During these visits, certain interviewed officials admitted that only barracks housing healthcare patients had their drinking water tested for Legionella, while standard accommodations were left untested. Security measures were found lacking. Broken windows and locks, malfunctioning security cameras, and inadequate lighting made it difficult to monitor the barracks effectively. In one instance, an ex-spouse broke into the barracks and physically assaulted a service member. Said disgruntled individual gained access without hindrance due to these deficiencies. The report also highlighted the risk of sexual assault in barracks, aligning with the well-documented issue in the U.S. military, and noted that approximately one-third of reported incidents occurred in on-base housing. Additionally, substance abuse was reported in multiple discussion groups, with one instance having resulted in a hospitalization after an overdose. Concerns about suicide ideation were also expressed by service members and first sergeants at various installations. In the backdrop of these circumstances is the Department of Defense's, DoD, inability to track the spending on military housing. The DoD's 2024 budget is a substantial $831.781 billion.